like podcasts too.
Yeah, too. All right, got it.
Good. Okay. So, hi there. I'm here today with Mandy Pullium. So, Mandy is a urogynecologist who has transitioned to be CFO, CMO,
CMO.
CMO of Axena. So, can you tell me a little bit about what you're doing and introduce yourself?
Sure. So I am a urogynecologist, fellowship trained in my background, and I spent about almost 20 years practicing urogynecology, first in Boston at Mass General, and then at the University of North Carolina. And then I got kind of a wild hair, and I was very interested in the technology that was developing for non-surgical treatment of urinary incontinence. And I jumped ship and I became the chief medical officer for a little startup company that was developing this technology. So that meant I got to lead research and development and sort of work to understand how the technology could be used to help women. Most recently, then, I have become the chief medical officer of a new company, Axena Health, that's continuing to work with the same technology that's been part of my work all along.
So, Mandy, you and I clinically have done the same thing. And, we talk about the pelvic floor and the pelvic floor muscles all the time. We talk about pelvic floor strengthening. So, why did you jump ship? I mean, why did you think that this was so important compared to what we have been traditionally offering to women? Right? So pelvic floor, physical therapy, maybe some of the peri trainers. I mean, how is this new and different?
Mhm. So I guess backing up a little bit, I would say that one of my strong sort of senses about women and pelvic floor health is that pelvic floor muscle health training, strengthening is probably one of the um, most important, but also sort of most ignored things for women. In other words, everyone knows they need to do it, and no one knows quite how, and no one actually does. It's sort of like flossing for your teeth. Do you tell the dentist you do it? You sure do. But do you really on a regular basis?
I think it's a
And I
little
and I
easier to floss though, right? And to know that you're doing it right.
That's right. You can't see your pelvic floor muscles, and in fact, trying to figure out where they are just on your own. I mean, it's almost not fair, I think, to ask women to go home and sort of figure that out for themselves, especially when it's something important enough to help make you continent and improve your experience both in your ability to exercise, in back pain, it's been shown, in your sexual life. It's just pretty critical, and I think it needs more direction than just a nod towards keeping those muscles healthy.
Yeah. And, even when I see women in the office and we talk about pelvic floor, and, I show them, kind of go over how to strengthen the muscles, where the muscles are, make sure they're contracting. Um, it never feels like it's enough, right?
Hmm.
It doesn't feel like there's, that let's call it 5 to 10 minutes, that's really enough to kind of um, get you going and get you on a program that's really going to help.
Hmm. I think there's a lot of, doing exercises regularly and doing them correctly. Um, it takes time to see results. And I think one challenge for a lot of women is that they start off with great enthusiasm. I mean, it's sort of like what happens in January with the diet. They
Yeah.
have great enthusiasm. They start off, 2 weeks goes by, they've been doing them, but they haven't really seen any change. And I think it's pretty clear from some of the research that we've done with our product that it takes about 4 weeks really to see any improvement at all. So this is an investment of time for women who have a problem like urinary incontinence, and I think it takes to a degree a commitment over time as opposed to a long period of time every day.
Can you go back to seeing an improvement? So I
Mhm.
just want to talk about that for a second because I think the data shows that you can see an improvement in muscle strength,
Mhm.
right? Well before you see an improvement in symptoms. So when you're talking about an improvement in 4 weeks, what are you talking about?
Sure. So I'm talking about an improvement in symptoms. I think that for many women, they know they need to strengthen the muscles in their pelvic floor, and maybe a question is why, or what's the point? And the point I think is, for many women anyway, it's functional. Do I have the ability to control my urine or my bowels? am I treating this enough to address back pain or my sexual concerns? I mean, so all of those things, the functional parts of the results, if you will, of strengthening pelvic floor muscles, those seem to take a little longer than the beginning of strengthening. Does that make sense?
Yeah. Yeah, no, I agree. I mean, I think, when it comes to incontinence, I think everyone wants to be 100% better, right? And so sometimes seeing an improvement in symptoms, it's hard to notice if you're doing it on your own, right? If you're not
Right.
kind of, keeping a bladder diary or a journal and documenting your symptoms, if there isn't kind
Right.
of an objective measure, sometimes after a month, you're like, well, I still leak a little bit. And it's
Hmm.
hard to remember if you're really better or not.
Right. I think one of the challenges is that for many women, those symptoms don't happen all of a sudden. I mean,
Right.
well, if you have a baby, perhaps you experience a lot of incontinence, and that may gradually get better over the year after your delivery. But as incontinence reoccurs, and it often does around menopause, the symptoms sort of gradually get worse. It's not as
Yeah.
though one day you have none and the next day it's terrible. And I think the repair and the rehabilitation of those muscles, the results of that kind of rehab also take that kind of time. It's just harder because now you've got this very bothersome problem that you really want to fix immediately.
Yeah. Yeah. And we're all a little impatient, right? I mean, or maybe, maybe it's just me.
No.
Um, s- so how is the product? Well, I guess I should ask you first, what is the name of the product that you're talking about?
Right. So we have the Leva pelvic health system, and it's a couple of things. One is it's an app that contains a ton of education about how to control your bladder, and in a few months we'll actually have additional information about how to control your bowels. And so there are lots of videos and educational materials, some quizzes, and all that sort of stuff. But also there's what we call the Leva wand, and that's a wand. It's sort of a small tampon-sized wand that gets placed in the vagina for 2.5 minutes of exercise twice a day. And when you place the wand, it connects to the app on your phone so that you can watch the exercises and really learn and understand whether you're doing the exercises correctly, and also watch as you progress and improve in your ability to do them. The final thing then is that we have a coaching team that connects via phone call or text to help with technical support, but also to help with the kind of support you need if you have a question about how things are going, if you need some support and encouragement so that you adhere to the program. And that coaching lasts for about 12 weeks. And then the final thing is this is a prescription device. So what that means is you have to interact with your healthcare provider to get the device. And also, as you're using it and going through the program, information then gets reported back to your clinician about how you're doing. So they can keep track of things with you and follow along, making sure that as you improve, they support you. And if you don't improve, that they can provide you with next steps if you need them.
How is this device different from what's out there,
Yeah,
right?
so there's a lot of stuff out there. I mean, if you
Yeah.
do an Amazon search, there's tons of stuff. And I'll say a few things. I mean, one is that the way in which our product shows what you're doing in terms of exercise is unique. We use a thing called accelerometers, which basically is just a motion sensor that shows what happens when you actually are lifting your pelvic floor and squeezing your pelvic floor. So you can see that you're doing your exercises properly. Also, you can see if you're doing them improperly and learn to correct. So that's different from the way most of the other devices out there show you how to do the exercises. But also, and I think this is important, we have a lot of published data in respected medical journals that show the value of using our product. So personally, one of the things that I'm committed to is providing women with products that not only do we say, look, these are great, they're going to work, but we also have proven it by credible research. And I would say that we have more credible research than pretty much any product out there that you'll find.
Yeah. And I think, being able to see how the muscles are moving is really important. And I think that, it may be something that a lot of women haven't thought about, but with traditional peri trainers, they're looking at pressure, right? And you can't
That's right.
really tell if you're contracting or bearing down,
Mhm.
right? And so when you use those, you could be using it completely incorrectly, but getting feedback from it that makes you think you're doing it correctly and not not realize that.
Right. And it's a challenge to be misguided. I mean, I think it's hard enough to do those exercises properly anyway, because you can't see the muscles. So you really rely on that
Yeah.
information to guide whether you're doing them properly or not. And one of the most common sort of improper performances of those exercises is actually bearing down. That's the opposite of what really you want to do. But you're right, those pressure sensors identify that as an increase in pressure, whereas a motion-based device will show that you're pushing down instead of pulling upward.
Yeah. Have you gotten any feedback about twice a day?
Sometimes women ask if they can do their exercises twice a day all at once, so 5 minutes in the morning as opposed to twice a day. And
Yeah.
we really haven't researched that, but in general, there's no reason that if that's what works for you, you shouldn't do it. I think the more important thing is to do them regularly. Most of our research shows that people use it on average twice a day in the research to get the results. And so occasionally people skip a day. I mean, something happens or you go on vacation or whatever, but generally twice a day for 8 to 12 weeks is what will achieve results.
Yeah. And what do women say about the product?
So
What
I
kind of
think,
feedback have you gotten?
yeah. So actually, there are a couple different ways that we look at what women say. I mean, sometimes women call and talk with us, and they talk with our coaches to talk about how this device has been helpful. And I think a couple of things come through. One is that women feel confident about doing exercises properly because they're getting this guidance on a regular basis. Another is that they do see results, and we learn of a lot of women who have seen life-changing results. And actually, another thing that we do is we collect survey results from everyone who uses the product, just so we can understand whether or not the women who use the product are actually improving. And if we had a problem, we could tweak our program, whether that's the coaching or the product itself. So we see a lot of good feedback from women about success stories and how that's helped to change their lives, both in terms of stress incontinence, urgency incontinence, or mixed incontinence, which is just a combination of the two.
Of the both, yeah. Um, do you get specific feedback about the coaching? I mean, I think the coaching is just such an important, aspect of it, right? That accountability piece, having someone that you can call and ask questions of.
Yeah. In general, women love it. I mean, there's occasionally someone that says, "Don't bother me," and we honor that. Some women prefer to have phone calls, and they they really develop quite a close relationship with the coach. Other women prefer to communicate by texting. But either way, we try to accommodate whatever the preferences are of the woman using the product. And it's definitely a unique relationship. And I think we have pelvic floor physical therapists who help to train our coaches as they're providing encouragement and support. And so we try to do a really great job of helping to educate women and support them as they go through the program.
Do you have any group support? I mean, I think a lot of women really want peers who are going through the same thing.
Yeah.
And so I'm wondering if you provide that at all.
So we haven't yet. We would like to, and I think that's definitely on the drawing board in terms of things that we'll do down the road. And
Yeah,
I completely agree with you. I mean, I think that one of the challenges about this problem is that many women think that they're the only one that has urinary incontinence, when the
right.
reality is, over
It's
50% of
everyone.
women in the country experience it at any age. I mean, it's not just older ladies, it's young women as well. And so we'd love to put people together in a group, and I think we're working through some of the patient privacy things and those sorts of things that will allow us to do that.
Yeah. And obviously it would be something you could opt into. I mean, I think some women
Absolutely.
really love that idea, and other women, it's, kind of a horrific idea and just the worst idea ever.
Right. Agree.
Just depending on, how much of a sharer you are.
For sure.
So yeah. So once you're done with the 12 weeks, then what? I mean, are you cured? Are you done? No more
Yeah.
exercises?
So that's a
Such a
great
loaded
question.
question.
Well, it is a loaded question. One, because it's important, but the other because there's really not a lot of information in
Right.
the medical literature about what happens. And again, another thing we're committed to, but we've just published another paper looking at this research study we did. We compared women who use Leva to women who have just done pelvic floor muscle exercises at home with a sheet of paper to help guide their exercise. And what we found is that in our research study, 8 weeks of using Leva right now endures in terms of the symptom improvement for at least a year. And we have 18-month and 24-month data that's almost ready. So we're excited about learning that, because I think it helps us to understand, if you do an 8-week intensive program, one of the things we think is that maybe women are learning to use those muscles again in their
Right.
regular daily lives, and so they can then go forward and use them, as they're meant to be. We'll see what happens over time. I mean, at 2 years, that's a long time to go without any directed exercise, and we may at that point find that women need a touch up or a little bit of a repeat effort. But at this point, we know that for 1 year anyway, those results hold.
Yeah, it's pretty interesting, isn't it? Because you would think if you stopped directly using the muscles, that they would atrophy, right? And that
Right.
all of that relief would go away over time.
Mhm.
So you have to be learning how to use your muscles more routinely, right? Although
Right.
I would say I think maintaining is easier than, strengthening.
Absolutely. Strengthening is an intensive effort. And I think, the truth about pelvic floor muscles is that we all use them every day. I mean, when
Yeah,
you sneeze, when you get up from a chair, when you run, when you lift anything, those muscles are engaging. And so it may be that the exercise program just helps you learn or relearn really what to do with them. I mean, if you think
yeah,
about it, women who don't have incontinence it's not always because they're exercising their pelvic floor muscles. They may just not have had the damage that requires them then to, rehabilitate.
right. And even with strengthening, I mean, you can have a strong muscle and not be using it at the right time, right? I mean, there is a lot of
Absolutely.
learning to incorporate it in your daily life. How
Hmm.
much of a focus, and this is actually something I've never asked you before, but how much of a focus on breathing is there in the education,
Right.
right? I mean, that's something that pelvic floor physical therapy always stresses so much, and optimizing all of those reflexes we have.
So our video training for how to do the exercises includes breathing
Yeah,
as part of sort of the methodology of doing the proper exercise. And I think that's true for much of. I mean, if you had a personal coach at the gym or someone who was showing you how to properly perform exercises, I think the breathing technique associated with pelvic floor muscle training, in some ways, it's a little counterintuitive about when you inhale and when you exhale. But
yep,
the video training that we have also shows when to do that, and also how to do that. One other unique thing about this product is that the exercises are actually performed standing up, which is, again, different from many other products. But the reason is that if you think about it, most people don't leak when they're lying down. They leak when they're standing up. They walk and they sneeze, or they trip over the curb, or they're running. And so performing the exercises standing actually, I think, helps give you the postural experience along with the proper breathing to engage those muscles when the time comes.
yeah. And I would think that would also make it a shorter program, right? Because a lot
Mhm.
of programs have you start lying down and then sitting and then standing.
Right.
And you really need to be activating those muscles, right?
Right.
When you're standing and you're up and about.
Right. And the exercise regimen, the 2.5 regimen, is 15 seconds of relaxation followed by 15 seconds of a lift. And then there are cycles of that through the 2.5 minutes. And when you start, many women can't hold those muscles in a lift for 15 seconds, right? So there's a progress as you continue to learn what to do. We see that over 2 to 3 weeks, most women learn to lift successfully and hold longer. So
Yeah.
we see those changes as women progress through the program.
Yeah, it's pretty amazing.
It's fun. It's
Yeah.
it's it's encouraging really to see that actually, one of the challenges I often face even when I go to the gym is wondering if exercise actually does anything. So it's nice to be able to see things that change even before I've seen the symptom relief that I want, which happens, in 3 or 4 weeks.
I'm laughing because I love and hate exercise, right? And anytime I'm lifting, I mean, halfway through, I start thinking that I'm like, this really isn't doing anything. I could be sitting down. I could be, right, doing something else. Right. Why am I doing this?
Right. I've become an
Yeah.
aggressive fitness tracker. I probably shouldn't do a product endorsement here, but I use one of those at-home bicycle things. And I can track my progress, and that's really been immensely motivating. And I think pelvic floor progress is the same.
It's funny, right? I mean, I think in order to be successful, you need a coach, you need encouragement, you need someone to keep you accountable, but then you also need to be able to track your progress, right? And
Right.
know that your muscles are getting stronger, that you're improving.
Hmm.
And if you're not doing that, you don't know, right? I
Right.
mean, it's hard to say. I mean, we're just not wired that way. You can't say, "Oh, yes, I am 20% better than I was a month ago," right? We just
Right.
don't think about it in those
You forget
details.
actually how much
Right.
better you are. And that's
Yeah, and I
especially
think it
true, I
makes
think, when
everyone feel so much better, right? When you can look back and say, "Oh my gosh, this is really working. I am 50% better. Maybe not quite where I want to be yet, but I am so
right.
much better."
Right. I think that's so true. And just, the other thing that we do with the product is we send a report to the prescribing clinician.
Yeah.
And I think, in my own practice of urogynecology, one of the things that I see so much is that women get lost. They get lost in the other things going on in their life or in other healthcare needs they have. And
Yeah.
so urinary incontinence can be sort of a lingering problem. And I think this allows a closed loop system where if your doctor sees that you're doing better, then you can communicate about that. And for some women, they may need more than non-surgical therapy. And if your doctor sees that you're not doing better, you can close that loop and continue to make progress
Yeah.
in your care.
I
Um,
think that's really true. One of the things that always makes me so sad if I have a patient who I've been seeing for a while and then I don't see them for a little bit and they come back in a couple years and say, "Oh, I just got busy," or, "I'm the
right.
exact same, nothing's better." But you know, I wasn't sure how to get in touch with you. I stopped doing the exercises. I got busy with life. I mean, getting busy with life happens, but
Happens.
we weren't providing them with the tools that they needed, right?
Hmm.
And I think over the last couple of years, we've really realized how much more everyone wants to do at home and on their own.
Right.
And
That's right.
so, being able to offer things that can be done at home, I think is so important, especially such a really smart device.
It's smart, and it can be private, and
Yeah,
it's discreetly packaged. So if you decide to take it with you, if you went someplace else, if you were traveling for business or went on vacation, you could. And it's a lot easier to do something, I think, at home. It takes less time than brushing your teeth. So I think it seems accessible. At least if I have one of those toothbrushes that makes me brush for 3 minutes, and that seems like forever.
that may be too much information.
I know.
Yeah, it's funny. I mean, we're all, there's a lot of do what I say, not what I do, right? And it's funny how we all need those reminders. Yes, keep brushing. Yes, keep flossing. Keep doing your pelvic floor exercises. Um, Well, I applaud you for this. I mean, I think this is great work. I'm so glad that you've transitioned to this. I mean, I think,
Thanks.
I really like being a urogynecologist. I like taking care of the patients that we take care of. But there's nothing that I would like better than to kind of put myself out of business, right? And if we could give women tools to handle these things without needing to come into the office or needing surgery, I mean, I think that would be, it's kind of the holy grail, right?
Mhm. Yeah, it is. And one other thing to say, as long as I'm talking about the product, is that it's now the end of February, and by mid-March of this year, we're going to be checking insurance to see if you're covered, if your clinician prescribes this device. We've had some coverage decisions that are positive from insurers, and so increasingly, I think women will find that this product is covered by their insurance, and I think that'll make it a lot easier for women to want to do it
Yeah,
if it's
I think
included as a benefit.
I think that's really true, right? There are a lot of things about these products and bringing these products to market that you may not realize, right? So, I mean, the marketing is one, getting it out there, but then also making a product like this covered by insurance so that it is easier for women to use. And, especially right now where there's such a limit of pelvic floor physical therapists throughout the
Yeah,
United States, it's nice to have other options that can be done at home.
yeah, I think so, and I think women deserve. I mean, urinary incontinence in the end of the day is a medical problem, and so I think they deserve credible, usable, data-driven things that will help improve their care.
Yeah.
And it should be covered by insurance. It's a medical problem.
Well, and I think, the data that you're putting out there and showing how long this works, right? I mean, that, I so many women have those questions, and it's hard when women ask me and say, how long will this work? How long will this last? Right? I don't want to do pelvic floor physical therapy if I'm not going to have a long
Right.
lasting benefit, and I know I'm not going to do these exercises every day for the rest of my life.
That's
Right.
right.
So having that data to be able to say, well, look, it looks like it lasts for a year, and we're continuing to look. I think that's great. And from my perspective, since I am still a clinician, um, even if it doesn't work perfectly and women go on to surgery or a procedure, I feel like the women who have a strong pelvic floor and who know how to work those muscles always do better in the long run, right? They have better results than people who kind of leapfrog to surgery.
I agree. And I mean, I think just very fundamentally, it's just better to be in shape.
Yeah,
And so, when you're going into surgery, I think many people think about getting into shape before they go into surgery if they can.
yeah,
And I think this is a great way to do it.
yeah. It does always come down to that, right? Be in shape, watch what you eat, all of those things we know that are so hard to do on a daily basis, but that is what it always comes down to.
It does.
Well, thanks for your time.
Thank
Before
you.
we wrap up, do you have kind of one tip, one thing that you would share with everyone?
Mm. So I guess what I would say is that, um, one of the challenging things for many women is making their own self-care a priority. There's so many other things that pull on your time, whether it's work or children or parents or grandchildren. And I think it's important to take some time for yourself. Not especially because I think it helps you care and be a part of the life of the people around you that you love. So I think this is a great opportunity, really, to take care of yourself, and it's critical.
I love that, right? I mean, I think you're right. We see that all the time when we're taking care of female patients, right? Women make sure everyone else is okay, excuse me,
They do.
before they take care of themselves. And spending that little time on self-maintenance, a lot of times, makes you healthier and more whole and gives you more to give away,
It's true. It's true.
right?
And
But
women
it's
give away.
Yeah,
They do.
but it's hard to get there. So,
Mhm.
so thanks for that, and thanks for your time.
Sure. My pleasure. Thank you.
Uh,